evaluation that we came up with at our committee, where we score you guys and give you comments and go through the milestones. But I wanted to just remind you, first of all, kind of how our system works. So I know we've been through this before, but I'll just kind of go through it. I know you looked at the overall evaluation that I gave you last week, and so we'll have we'll have the time to go through each page. But just in general, kind of how it works. So for each competency, and this is the first one, patient care 1, how you care for acutely ill or injured patients in urgent and emergent situations in all settings, so office, hospital, wherever. We have the different levels up here that with specific examples of what you need to have achieved to achieve scores down here on this row. And the way that works, you see that there's a box in the center of each level and then one in between the two levels. And in order to achieve the score that's at the bottom of the level in the center of the column, you need to have the ability to do everything that's listed in that column.
Okay.
If you can do everything in that column and then half of what's in the next column, but not all of it, then you would score the one that's in between. So in this situation, if you can do everything that's in level 1 and half of what's in level 2, then you would get a score of 3. And as a third year resident, we would typically expect that your scores should be up in the sort of 7 to 9 range.
Okay.
For the most part. And if you look back at your previous evaluations, you'll see that there's, for the most part, pretty steady progression from where you were first year to where you are now. So halfway through your third year, we would expect you to be pretty consistently up in that range. If there are a few scores that are a little lower than that, and as we go through it, you'll see that there are a couple that we can go through. Then those are just simply areas that maybe you need a little bit more work, or we can kind of focus on as we kind of finish out your training. But that's kind of what our expectation is. That's kind of where you should be. So you should be able to pretty much do pretty consistently the things that are there in that level 4 column, getting those scores in the 7, 8, 9 range. So
Okay.
okay.
Okay.